report from the Centers for Disease Control and Prevention revealed opioid overdose deaths climbed 30% during the first year of the COVID-19 pandemic nationally, with Black, American Indian and Alaska Native populations bearing disproportionate shares of the increase. Hello and welcome to Medical Dialogues, your daily dose of health and medical news. I'm Mr. Zaman, and today I'll be talking about a new study which finds that almost 90% of people with opioid use disorder are not receiving life-saving medication. While the opioid overdose and death epidemic continues to worsen across the US, medications such as methadone, buprenorphine, and extended-release naltrexone are proven to reduce opioid overdoses by more than 50%. New findings led by researchers at NYU Grossman School of Medicine indicates the vast majority, or 86.6% of people living with opioid use disorder or OUD, who are not receiving these evidence-based life-saving medications. The study, published in the International Journal of Drug Policy, examined the gap between new estimates of OUD prevalence and the use of medications to treat opioid use disorder or MOUD at the national and state levels from 2010 through 2019. Although the use of MOUD has grown by more than 100% over the last decade, this rise in treatment has failed to keep pace with OUD and skyrocketing overdose mortality rates, largely driven by fentanyl, a potent synthetic opioid up to 50 times stronger than heroin. Our findings highlight the urgency of removing barriers to accessing medications to treat opioid use disorder while expanding the availability of these medications, says Noah Krozik, a lead author of the study. But what we have is way beyond a simple treatment capacity problem. We need to rethink how treatment for opioid use disorder is delivered, eliminate stigma, make it easier for people to enter and remain in treatment, as well as ensure that all treatment programs provide and encourage use of evidence-based medications that we know save lives, she added. Ways to expand access to MOUD could include removing special waiver requirements so that more physicians can prescribe buprenorphine, as well as expanding the development of MOUD by mobile health clinics and community-based organizations and within the criminal justice system. Making methadone less controlled and more accessible through avenues other than highly regulated opioid treatment programs is also long overdue, said Krozik. That's all for today. Stay tuned to Medical Dialogues for latest updates.
Never miss a medical update from Medical Dialogues. Like, subscribe, and press the bell icon.